Welcome to another episode of Health Matters, a production of KFUG Community Radio. I'm here with PA Lynn Szabo. And what are we going to talk about today, Lynn?
Viral gastroenteritis. Yippee! It's
Ew.
back. I think I've talked about this before, but it's going through the town right now. So I thought it would be good to revisit. So viral gastroenteritis is the stomach flu.
Yuck.
Dun, dun, dun. And it's going around now, mostly in the kid population. It is the triad of symptoms of nausea, vomiting, and diarrhea. How much fun is that?
That's no good.
Yeah, sometimes fever, abdominal pain, and lack of appetite. I think that we're kind of a little bit more at risk of it because we rely on tourists and people traveling from out of the area. So I think it makes its rounds through our community kind of quarterly, maybe 3 times a year.
We do seem to have that passed around a lot here.
I know. When I was in urgent care, it was kind of fun watching it move through the community.
I don't like your definition of fun, Lynn.
I know. Urgent care has that ability to see how disease moves through a community. And it's I actually found that to be kind of helpful because then I could go back to my regular family practice clinic settings and say, well, this is going around. And people and the other providers who are not focused on that would be going, Anyway.
All right. Well,
Yeah.
cool.
So mostly transmission is from person to person, but since it's fecal oral transmission, oh God.
Gross.
It can be
Threw that
transmitted.
right out there.
I know. It can be transmitted through food, fomites. That's FOMITES, which is kind of like a coffee cup, for example, or the doorknob on the bathroom.
Okay. So can I just back up here to the food poisoning thing? So that is that somebody's contaminated the food because they didn't wash their hands properly. That's not because that it's
No,
food poisoning because
it's something different.
okay.
Yeah.
So I just wanted to clarify.
Yeah.
You got sick because somebody contaminated your food with their own illness, not because somebody didn't keep it at the right temperature or it's got listeria or E. coli from
something totally different. So this is viral in origin. And what you're talking about with food poisoning is usually bacterial. And it's kind of like, maybe somebody mixed the salad with their hands without washing it and got the normal staph germs that would be on somebody's hands. And it sat out in the sun while the barbecue was going on and just became a disease entity. That's different from virus.
Okay. So like if I had the norovirus and made you a sandwich, I'm giving you the norovirus in your sandwich. It's not because your sandwich was contaminated with food poisoning stuff.
Right.
Okay.
Exactly. Those are 2 different disease entities.
Gotcha.
But since it's fecal oral transmission, it can be transmitted.
Just not say that anymore.
Stop saying that bad word. From food, from fomites, which are things like dirty forks and stuff.
Okay.
Water. Okay. And this is so gross. Aerosolized vomit. I know.
You're gonna have some here in a minute. You
Ack.
stop.
So let's pause here to remember a lesson we learned during COVID. So unless you want a face full of gross stuff, lower the toilet lid before you flush.
Oh.
And it doesn't matter what you left in the toilet bowl because other people, or maybe even you, have used it previously for different things. So you are not fast enough to avoid a face full of virus after flushing.
Right. Then it goes up into the air. Then it's going to land on all of your surfaces, including your toothbrush, in the bathroom. Close the damn.
In your face.
Close the toilet
Face.
lid. Yeah.
Yeah.
Close the toilet lid.
So this is something we learned and I actually found this article in like a fluid dynamics thing, and they did a study in China with the COVID virus, and that as it moved through a hotel, and they were wondering why they got the pattern of illness that they got, and actually it was moving through the sewer pipes and then popping up in people's faces. So before you flush, close the lid, okay? It's not that hard. And if you think, well, I'm really fast, you're not fast enough because they looked at that and it's like nanoseconds. Yeah. Super gross.
It is super gross.
And move your toothbrush a little further away.
I'm gonna go with that's a boy thing. I'm gonna go with that's what boys do.
Yeah, I don't know. Anyway, from most of the viral gastroenteritis is caused by norovirus, which is kind of cruise ship fame, but there's also rotavirus, and rotavirus is dangerous mostly to infants and toddlers.
Aww.
There's a safe, effective oral vaccine for it.
Really?
I just thought I'd throw that in. That babies get at 2 months, 4 months, and 6 months, and it's not a shot. So if there's a concern about needle pokes, it's not a shot, it's an oral vaccine.
Wow.
So super important because babies can get dehydrated and they crash really easily.
Yeah, they do.
But most of us adults and maybe older kids are suffering from what's called norovirus. And that's the classic stomach flu. It has to be, I was taught in PA school that it has to really embrace the triad of nausea, vomiting, and diarrhea. And I'm a little light on the vomiting. I'll go with nausea and diarrhea if people say, yeah, I felt like I was going to throw up.
Okay.
But you really need those three things there, because if it's not stomach flu.
Okay.
And I've seen this diagnosed kind of wishful thinking in certain venues in this county where people only had part of that triad, and they were diagnosed with stomach flu, and what they really had was something else.
So is there a difference between the stomach flu? Because I've had norovirus once, and it seemed to be substantially worse than what I've always thought of as the stomach flu. Is there a difference? Is like, the norovirus thingy was just
I think you're talking
awful and so incredibly contagious.
Yeah, but you're also kind of looking at the interaction between the actual viral illness and where an individual is at that moment in time. Are they healthy? Are they not healthy? Did they get a couple of little virons? Did they get a bunch of virus? Stuff like that. In what way did it enter their body? Like, for example,
family visiting. It entered through family visit.
Yeah.
And it took out the entire family, and we were all horrendously sick. So, it was.
Yeah. You can, if
those darn little kids.
If you share it in families like that, the mom especially goes down.
Yeah.
Because the moms are, changing diapers or wiping things down or, trying to clean up vomit and stuff like that. So what really should happen, risk factors are close contact. So we were talking about that.
Okay.
With an infected person or poor hygiene, which is just blowing off the hand washing thing. And I want to mention a famous outbreak we had. I don't remember exactly when it is, but something I saw in urgent care. It was the tourist time of year, so I think early summer. And an employee went into a bathroom of a chain restaurant that's located here in Del Norte and had to clean up the bathroom because somebody was incontinent, a stool like all over, probably a kid or something. And then that person sought medical attention about a day later because they had nausea, vomiting, and diarrhea. And then all of a sudden, all the workers at that restaurant started coming under urgent care with complaints of nausea, vomiting, and diarrhea. And then it kind of just like ripples on a pond. It just went through the entire community, and everybody was sick.
Especially if it's a popular chain restaurant where we're all going to
right.
get food.
And it was a chain restaurant where it would be really easy for an out-of-towner to stop. So, I don't think that the restaurant was at fault.
Yeah.
It was, and I don't think the employee was at fault. This is a very transmittable virus, and I think it happened to be a part of the year when everybody was well. It does happen here. And then all of a sudden, I happened to see patient 0. And then all of a sudden, I watched it move through the whole community. So super contagious, really gross.
Yeah.
What can you do about it? Well, the diagnosis is straightforward. It's a clinical diagnosis. There is a test where you can test stool. The hospital uses it a lot. They get about 45 different things that cause diarrhea, from virus to like Giardia, and they run all of them, and it's a DNA test, so there really isn't any room for error. However, that comes back usually after people are better. So this
is what you did have, but it's gone now.
Yeah, that's that might be more intellectual curiosity rather than a good clinical information in a good time frame. So you need the triad, like I said, of nausea, vomiting, diarrhea. And what you need to do is make sure that there aren't risk factors. So other risk factors for different types of GI kind of illnesses is there blood in the stool? Does the person have used well water? And we've talked before on Health Matters about how you get your water tested. Everybody is always certain their well water is great, but they never test it. So,
I didn't even think about that. How often should you test your well water?
Once a year, I think. It depends on what kind of system you have.
Okay.
A lot of people have no system, so maybe quarterly for them. A lot of people have really groovy, like UV lights and special filters and stuff, maybe less often for them.
Okay.
You have to be really clear in your history taking that this person doesn't have other risk factors like travel, especially travel out of the country.
Okay.
Or things like backpacking. So maybe somebody went out in the Trinity Alps, well known that there's Giardia up there, and they didn't filter their water correctly. So those questions should always be asked in the encounter between the provider and the sick person. Patients always refer to this as food poisoning, and they want to oftentimes talk about bad food at a bad restaurant, but that's not really what this is. Food poisoning, like we said, refers mostly to bacterial infections and infestations or waterborne illness, but you can't really blame it on the local restaurant in the way you think. Now, this always brings me to the swamp. And I think about why do we call it the swamp? It has a really high water table, right?
Yeah.
And what's the sanitation like out there? Not great, I would imagine.
I think we talked about this a little bit before, and
Right.
I have yet to go and verify it. It's my understanding the local permaculture guild went out there years and years ago, and kind of showed them how to do the sanitation so that it didn't get into anywhere they were drinking or digging wells illegally or anything else and drinking the water, and to keep that safe. But you've worked with the homeless population before. Maybe we.
I've asked them.
Do we have issues with the
they
contaminated?
just blink. I say, how do you poop out in the swamp? And they just blink. They just squat.
Yeah. Do you have issues with having them come in from having issues from drinking contaminated water? I mean,
I have not seen that yet. I think that's a sleeping bear. I think at some point somebody's going to poke the bear.
And talking to the Ruths, they grew up with it because we think it's a new phenomenon, and it's not. Right. It's been out there for generations, multiple generations, and so they're telling me that it's been that way for almost 70 years. That's all they know. That what it is now is what it's always been. Right. So there has to be some kind of a system that they have been using with outhouses and things like that they've just passed down. I mean, because there's never been an outbreak again, and it's called the swamps for a reason. It gets inundated with water.
Right. Well, there's a certain age group that didn't get immunized for hepatitis A. So I think what might be interesting from a epidemiologic point of view is and hepatitis A is transmitted by oral fecal contamination. It's a different virus than what we're talking about.
Yeah.
But it would not be inconceivable that it would roll through a community like that. I think they tried their best, but I also do not think that they're always successful at taking care of themselves the way we would hope.
Oh, no, I absolutely agree with that. And I do know, having gone out there to do the interviews and things like that too, especially with the illegal dumping, they get all upset about it because that's contaminating their water. And that's what they'll tell you. Like this, we have to clean this up. This is it's their kids' diapers. It's all, it will make our pets sick. It will make us sick. We have to get this out of here. And they just dump it. And we have definitely less than 2 days to get it cleaned up and out of this area, or we're all going to get sick. So they kind of know that things have to be out of an area, that this is where the water flows. And some of them have been out there living in that area for 30 years. So they've seen it. They've experienced it. So maybe somebody at some point.
It might be interesting, although it would depend on who would do this, to take water samples and run them through the water quality lab by the poop plant and see what's actually in the swamps. I mean, we have a lot of hypotheticals, but nobody has any data.
Right. I think you're right. That's a good idea. And then also too, if we can just get blood samples, there's a point in time surveys coming up in on the 27th, I think, of this month.
Uh-huh.
Right, to do blood samples to see how prevalent the hepatitis A is out there. But yes, that's good.
Or is it even a thing? Have we immunized enough people that it's not even a thing? But hepatitis A showed up, and most of the people in their early 30s were the first people that were getting it as kids, getting the immunization. So if you're looking at people who are, let's say, 35 and up, those people are not as likely to have been immunized, although some of them might be immune just because they had a disease as kids.
Okay.
So I think that would make a nice little research project for somebody, as long as they use the results in a responsible way, because I think those results could be used irresponsibly.
I agree.
So what's the treatment? Let's say you're miserable. What do? No antibiotics. This is a viral illness, and antibiotics, inappropriate antibiotics, can really make you sicker. So an example of how to get sicker is where you take air quotes, antibiotics to cure your stomach flu, and then you end up with Clostridium difficile, which is a bacterial diarrhea that's really contagious and really awful and can actually put people into quite a bit of physical distress.
And that's C. diff, right?
Yeah, C. diff.
That's what we know it as. Mm-hmm. Okay. Now, say its real name again?
Clostridium difficile.
Okay, that's why we call it C. diff.
Okay. We call it C. diff. Yeah, that's why your provider should say, is there any blood in your stool? Because if there isn't any, it's unlikely you have that. That should also probably say, have you been on antibiotics recently? But that's, I think, less important. So if there's no blood in your stool and you haven't been on antibiotics recently, then your risk for, and you've never had C. diff, your risk for C. diff goes way down. Do not take meds to slow the diarrhea, because slowing down the diarrhea can make you much sicker. So your body has got some body wisdom here, and it's telling you, I got to get this out of me. And so even if that means you're pooping, profuse watery diarrhea once an hour for like 12 hours, it's really not a good idea to go get, send your significant other down to the store for some antidiarrheals. Okay.
So just drink, stay hydrated, and let it work itself out.
Yeah, hydration is key. And what I read, and I thought this was new to me, I thought this was interesting, instead of getting something like Gatorade, focus more on Pedialyte.
Oh, yeah.
So rehydrating solutions with more sugar in it tends to draw this out.
Okay.
That kind of makes sense, although I never thought about it before. I think it just gives the virus more to eat. Okay. So Gatorade also doesn't really have the electrolyte that, let's say, Pedialyte would. And the electrolytes, the imbalance of electrolytes, especially potassium, becomes super important. And that's why Pedialyte, I think, is a better choice. And this is the first time I've ever actually seen that written. So there's some science behind this, and then also some hard data.
Sweet. My mom was always right then. So what about they have the hydration salts?
Yeah, those are recommended.
Okay, so kind of like the Pedialyte do the hydration
and those
salts?
those are given out by Dr. Turner with his homeless
nice
medical mobile van.
Okay. So always better than the Gatorade is to go to the Pedialyte.
Yeah, they have a bunch of freebies out there.
And then for anybody who is like, oh, Pedialyte's gross, because it does have a weird texture and it does have the flavors. It's just horrid. If you buy the unflavored Pedialyte and then you get a sugar-free Jell-O or a little bit of a Jell-O packet and literally just like a quarter of a teaspoon kind of a thing, a little bit in there, and then you just shake it up. It flavors the whole entire bottle, the big bottles that you buy for your kids when they're sick.
Right.
And then it tastes good.
Yeah.
And then you can get your kids to drink it. Pedialyte's nasty.
I know. Pedialyte pops are horrid. A kid is really sick if they go for that.
Yeah.
But when I was recently a medical chaperone for a trip, a school trip to the Yucatan, and it was really, really hot during the time we were there, and those kids were dropping like flies. They would suck down the Pedialyte. You can buy Pedialyte there. They call it sueros, and they are every Hispanic mom is like all about it. So I was handing it out to them, and
nice.
They get better pretty quickly.
Yeah, getting rehydrated helps so much.
Right, so much. Brat diet. is recommended, but there's no data really to support it, and that's called the bananas, white rice, applesauce, and toast. Dry. It's meant to be dry toast. It's what we've recommended to moms who have sick kids for 40 years since I've been in medicine, and it's not data driven. So I don't think it hurts people, but it doesn't really help as much as probiotics.
Okay.
Probiotics are actually moderately helpful.
Like yogurt.
Yeah, but you have to get the ones that are live. So you can't go for the gummies that are on the CVS shelf, okay? Because those are dead. So get yogurt. But then I'm going to say it's also important not to go for dairy.
So eat the yogurt, but don't have dairy.
What? So I usually recommend kefir because you can get a lot of concentrated probiotics in that, and you're only doing a really small amount of dairy. And goat yogurt and goat kefir exist, and they're considered non-dairy.
Ugh.
I don't know why.
Because they taste like a barn.
Yeah.
That's only good in cheese.
Yuck.
So you do recommend the kefir, though?
I recommend kefir.
And kefir tastes better than yogurt anyway.
Yeah, it does. And you don't have to drink as much if you're kefir averse. So some medication for nausea can be helpful, especially in kids because they get dehydrated super easily. This would be like a prescription med that would include what's called Zofran commercially, but is ondansetron generically. And that's good for kids because it dissolves in the mouth and it doesn't taste gross. Kind of tastes like... Does it?
It tastes awful, but it still works. And when your kid's vomiting, they don't care because it tastes better than the vomit in their mouth. And so,
you're only giving them little scrumbles. If you're working with a small kid, you're talking about a half to a quarter of a dissolvable 4 milligram.
And it does work. And then they don't throw it back up because it's dissolved under their tongue.
Yeah, that just dissolves, and you can't throw it up. However, in my research, and I never thought of this, I don't know why, you can consider Dramamine in a pinch. So if your mom, let's say you're driving down the Bay Area because you have sick parents down there you're trying to take care of, but your kid's thrown up in the back seat and got diarrhea, and you think maybe you're actually bringing them viral gastroenteritis, what are you going to do? You pull off the road and get some Dramamine and get your kid to take it.
Okay.
So, and that helps. Dramamine is just antihistamine. So it just makes people sleepy, but it seems to work as an antihistamine. Some of them work better on one thing than another, and this one seems to work on vomiting very well. Monitor for dehydration, and be aware that lots of diarrhea can cause problems with electrolytes, especially potassium.
Is that kind of where the brat diet stuff came from? Because the bananas are high in potassium. This is what you're going to eat to replace those things?
But the bananas are the only potassium positive thing in there. I don't think applesauce is. Applesauce has pectin in it. White rice is kind of neutral and easy to digest, and same with dry toast. Although I wonder if the gluten in dry toast can sometimes be harder on people than it's worth.
Yeah,
maybe saltines or something.
I was always told that the rice in the brat diet was supposed to be rice water. So you take your white rice, warm it up a little bit on the thing, and then you let it kind of just sit with the water, and then you give on the empty stomach, you give the kid or yourself, you drink that rice water, so it helps you rehydrate.
Right, that's the grandma version of
but
diet.
you don't you don't actually eat the rice, you just drink the rice water.
We've always said eat the rice, but whatever. And then how do you prevent this unholy occurrence?
Don't have children.
That's not going to save you. But anyway, don't go to commercial restaurants in Del Norte during high tour season. Don't go on cruises. Those are all places
Everybody
where this
move to the mountain in Gasky and stay there for 6 months.
Right, that's right. So prevention is simple. It's wash hands constantly and correctly. Okay, don't wash hands like your PA does, 10 seconds. You're really supposed to sing happy birthday twice.
So are you saying that the PAs are giving us all this sickness because they don't wash their hands correctly?
I'm going to say this PA could do better.
Oh, Lynn.
Yeah, I'm trying.
It's a good thing we love you.
Yeah, I know. But in the sick person, this is key, and this has been since COVID I've had this realization. The sick person should have their own bathroom if it's at all possible. and close the toilet lid before they flush. And it doesn't matter if they just peed a little bit. If they're going to flush, they close the lid.
Gotcha.
Okay. And then if you don't have a bathroom that the sick person can have all to themselves, you probably have to send a gloved adult in and to clean up in between uses. And of interest, these viral infections, this is hot off the press, may lead to lactose intolerance in people and intolerance of certain proteins once the illness is over.
Wow.
So, yeah, I'm mind blown on this. But if you have certain gut flora that helps you digest dairy products, and you kill them all, okay, then you're going to have problems maybe with that not recolonizing, and you might have problems with milk.
Wow. So does that, if you have that issue with not having that bacterial flora in your, does it come back? Like, can you?
I think eventually it could come back, but it's going to be a little bit.
So you could be sometimes lactose intolerant, and then after it all grows back, you're okay again. You can have.
Right. It's not a permanent condition.
Okay. That is so weird, but it makes perfect sense. I'm not saying that you made it up. I'm just saying it's just.
I never thought of it.
Me either.
Pre and probiotics are key, and like I said, I like kefir.
All right. Okay, so pre and probiotic, but not the gummies because those are dead.
No,
so it has to be
living ones.
Okay, now at this point, so if this is prevention, so at this point you can have the dairy. So drink the kefir, eat the yogurt, that kind of a thing. All right. So what do you think about those? Those like what do they call it? Kombucha to have the probiotics. Is that kind of a thing, or you don't know anything about that? I mean,
I didn't see anything specifically relating to it, but it makes intuitive sense. Some kombucha actually is alcoholic, isn't it?
I think it all essentially is, but it's so low that it's like I mean, a kid can go and buy it at the store. It's not
okay.
It's not
as long as a kid can buy it. I think a sick kid can drink it.
Yeah.
Yeah.
So it's just made with black tea and fruit, and then by anything like that's going to have that sugar. You're going to get a little bit of a.
I don't think I would give them homemade kombucha though.
Okay, no homemade.
While they're stressed.
Okay, so but if this is preventative, what we're talking about, homemade kombucha is okay?
I think it depends who makes it. I haven't, number one,
that is true, because you can't eat at everybody's house.
Very many people make it, and the one person I did see make it was a physician. So I would, if she gave me some, I would drink that. But I don't know that I would like go to a random household and go for it.
I mean, you can't eat at everybody's house, Lynn.
Yeah.
Don't eat the potlucks at work either.
Oh my God. Bring your own silverware. That's from an infectious disease physician I worked with. He would never use the staff silverware.
I thought that's why everybody had disposable.
Well, I don't do disposable, so I have my own bamboo made.
Okay.
I was handed out to us at UHS.
Nice. All right, nice. I'll go and invest in my own, bring my own silverware stuff. All right.
It's worth it. So that's the story. And next week, I want to talk about urinary incontinence in postmenopausal women for all you women who just laughed and regretted it. So it's a
real thing.
It's a real thing. There's suffering associated with it, a lot of suffering. I actually saw a man in clinic in the last month who suffered from it too. And pelvic floor laxity is a problem for a lot of people. And we have, I think in medicine, we have a better way of looking at it now and more that we can offer people.
Okay. Yeah. And right, because it's physical therapy that you can do for that. We just don't have physical therapy for the pelvic floor anywhere around here anymore. Oh, they all left.
That's right. There's surgical options, though. And some physical therapy is moving toward Zoom. And I'm thinking of having the PhD physical therapist I've been working with who lives in Portland talking to us, too. So
nice.
Yeah.
That'd be pretty
Solutions on the horizon.
Yeah, absolutely. Well, thanks so much, Lynn. I appreciate you talking about the yuckies.
Yep, the yucky stuff.
The yuckies, right? And then I look forward to talking to you next week. If you'd like to listen to this episode of Health Matters or any of the other episodes, you can always find them on the podcasting platforms where you listen to your podcasts, or you can make it simple for yourself and go to KFUG Community Radio on YouTube, select the playlist, find Health Matters, and listen to all 7 years of Lynn. Thanks, Lynn. I'll see you next week.
Alrighty. Bye-bye.